Welcome to This Explainer. Today, we're diving into a piece of research I recently published, specifically geared toward those of you actively pushing the boundaries of science and capital, the academics, the investors, the biotech strategists. We're going to take a really critical systems-level look at the intersection of AI and the life sciences. Look, there is an absolute flood of capital and excitement pouring into AI for drug discovery right now. But as we'll uncover today, much of this effort is, well, it's actively optimizing the exact wrong variables.
So, let's start by completely shattering a prevailing myth, using a quote straight from the research. You've all probably heard the standard keynote stage narrative, right? If we just build a sufficiently powerful AI, disease simply becomes a solved information problem. That logic basically assumes the human body is just a system we can read from and write to, and enough compute power will eventually spit out the cure. But this fundamentally misunderstands the reality of medical science. AI is an unbelievably powerful weapon for sure, but when it's pointed randomly, it hits nothing.
To figure out where all this capital, brain power, and compute should actually be going, we need a solid framework. We're going to hit 5 main points today: the magic bullet myth, the 3 stages of discovery, a concept I call perfect marksmanship, bad aim, why biology is not engineered, and finally, the real AI bottleneck.
Okay, diving right into Section 1, the magic bullet myth. Let's talk about why AI literally cannot just reason its way to new cures without a grounding in physical reality. Here's the crucial takeaway. AI can only cure diseases if the cures already exist within a dataset that we've actually measured and are just sitting there waiting for a better algorithm. But here is the really blunt reality. They don't. The vast majority of human biology has never been observed with anywhere near the detail required to target a therapy. Think about it. There are roughly 10,000 known human diseases, and most of them have 0 approved therapies. For rare diseases, you're looking at something like a 95% failure rate to find any treatment. Modern medicine is mostly just symptom management, not cures. And the hard truth is, no amount of computational inference can recover data that was never collected in the first place. AI will absolutely transform health, but right now, all that capital is aimed at the wrong stage of the problem. To build out our mental model of why this happens, let's move into Section 2 and look at the 3 stages of discovery. Confusing these stages is honestly the root of nearly every bad forecast in biotech today.
Drug discovery breaks down logically into these 3 distinct steps. Step 1, disease to mechanism. This is where you identify a target in the body where intervening actually changes the disease. Step 2, mechanism to drug. That's building the molecule, a small molecule, an antibody, whatever, to hit that target safely. And step 3, drug to patient. Running the clinical trials to see what the drug actually does to a living, breathing person. As we map this system out, keep these steps completely distinct in your head, because once you do, it becomes glaringly obvious where our resources are pooling and where they're completely starving.
Which brings us nicely to Section 3, perfect marksmanship, bad aim. This is where we confront the massive misallocation of capital and compute power happening right under our noses.
And herein lies the paradox we're trapped in. Nearly all of the massive AI investment has landed squarely on Stage 2, building the molecule. And let's be fair, computational protein structure prediction, that was a monumental scientific achievement. If you give us a mechanism worth hitting, we can now design something to hit it faster and more precisely than ever before in human history. But honestly, that precision doesn't matter if you're aiming at the wrong thing. For the overwhelming majority of untreatable diseases, we just don't know the underlying biological mechanism. So we can design molecules flawlessly, but we're effectively shooting in the dark.
This lack of deep mechanistic conviction, it's exactly why we see a staggering 90% failure rate for drugs entering clinical trials. 90%! That figure has basically been flat for 3 decades. And here's the real kicker. In most of those failures, the molecule did exactly what it was engineered to do. It hit the target perfectly. The problem was simply that the mechanism was wrong. Hitting the target didn't cure the disease. Molecular design is not where drug discovery succeeds or fails, and frankly, it never was.
For the investment pros and strategists tuning in, this data reveals a massive structural misallocation of capital. Look at this. Over the last decade, the global R&D pipeline nearly doubled, jumping from about 11,000 active programs to 21,000. Yet the number of novel biological targets entering the pipeline plummeted by 70%, from around 100 a year down to just 30. We're seeing extreme crowding around known biology. Everyone is pouring billions into slight tweaks of validated mechanisms. Think of the frenzy around GLP-1 because actual conviction in new, unproven mechanisms is incredibly rare. The opportunity cost here? It's the hundreds of millions of patients whose diseases literally have no mechanism being investigated by anyone.
This crowding is a symptom of a much deeper misunderstanding, which we'll cover in Section 4. We really have to face the gritty reality of human systems. Biology is not engineered.
There's this widespread, almost naive belief right now that large language models are just going to read all published biological literature and magically synthesize brand new disease targets out of thin air. But the dots they need to connect, they don't exist yet. Now, we do see efforts to build virtual cells by pairing models with large-scale experiments on immortalized cell lines. And hey, that's a good instinct. But treating an immortalized cell line in a petri dish as a proxy for complex human tissue, it's literally like assuming a wind tunnel behaves exactly like a global weather system. Descriptive maps of biology just can't tell you what happens when you introduce a drug, which is a highly dynamic intervention.
Human biology is incredibly, wildly messy. It spans all these interlocking layers, from the genome all the way up to the entire organism. It was not engineered top-down by a software developer. It's the residue of billions of years of stochastic evolution. You've got countless genes, cell types, contexts, each behaving on its own highly idiosyncratic terms. You simply cannot derive it from first principles. On top of that, the hardest diseases we're trying to cure, like Alzheimer's or ALS, are temporal, systems-level dysfunctions that are exquisitely human. Rodents do not get Alzheimer's. You can't solve this through computational inference alone without massive, capital-intensive physical measurement of living human systems. And there's just a stark contrast between the tech world and the bio world. AI agents absolutely thrive wherever the scorecard is fast, cheap, and accurate. In software, a coding assistant improves at lightning speed because a compiler tells you if you're right in seconds. The feedback loop is instantaneous. But drug development, it's the exact inverse. The only truly conclusive scorecard for human biology is a human clinical trial. These take years, they cost hundreds of millions of dollars, and they're subject to the agonizingly slow pace of living biology. Literally no quantity of compute can compress the time it takes for a biological process to naturally unfold in a human patient.
So, if we can't solve human translation by just rapidly optimizing molecular design in a closed-loop lab, we have to identify where the constraint truly lies. Let's look at Section 5, the real AI bottleneck.
There's a really popular thesis right now that says, just compress everything. Shrink the operational costs, target the clinic, and the whole system accelerates. And yes, things like predictive toxicology, AI-drafted regulatory filings, automated data management, those are fantastic process improvements. But let's look at the actual timeline. Investigational new drug prep and operational logistics account for roughly 50% of development time. The other 50% is strictly in vivo biology, literally just waiting to see how a disease progresses in a human body. So even if AI compresses everything it can currently touch, comprehensively and optimistically, your total development time optimally falls by only about 10%. The vast majority of the process remains structurally untouched.
Which brings us to the ultimate truth of this entire analysis. The absolute binding constraint in drug discovery is not molecular design. It's not literature synthesis or lab throughput or trial logistics. The binding constraint is identifying a mechanism whose modification actually changes the disease in a human being. Value is entirely concentrated at the bottleneck. Generating data at scale, deliberately, from human systems is capital-intensive, it's slow, and honestly, it's unglamorous. But it is the only input that makes the rest of the AI stack worth anything. Intelligence was actually never the scarce resource here. Deep, mechanistic understanding of human biological systems is.
So, I'm going to leave you with a final thought to mull over for your own research and capital allocations. Are we going to keep using brilliant, state-of-the-art AI to simply industrialize perfectly designed failures, or will we actually have the courage to redirect our capital and our focus toward the incredibly hard, unglamorous work of truly understanding human biological systems? Because for the hundreds of millions of people out there waiting for a cure, the distance between a wrong mechanism and a right one is the distance between just another expensive failure and a completely life-changing treatment. Thank you so much for joining me for this explainer, and I can't wait to see how we collectively tackle this grand challenge.